Uncontrolled hemorrhage is the leading cause of death in the trauma patient. When lives are at stake from major trauma or surgery, we use this level 1 rapid infuser to provide rapid infusion of normothermic blood and IV fluids. Even a little bit of drop in temperature in the trauma patient can cause a delay in recovery and also can allow infection to set in quicker. So today we're going to go over the tubing used in the level 1 device and how to set it up. So first we're going to start with our tubing. These are your spikes for your IV bags or your blood bags. For today's purposes, we're just using IV bags instead of blood. Here is each of your clamps. These are important when switching in between each pressurized system. You have your drip chamber, which is important to make sure that your flow is going the way you want it to. This is your heat exchanger unit. This allows for the fluids to be heated properly before going into the patient. Then you have your blood filter and then your gas exchange unit. You have another roller clamp, an injection port for other medicines so that way you don't have to keep changing the tubing, another clamp, and this is the terminal port that goes into the patient. So we're going to start at the top. So you open each of your pressurized systems. This is the air bladder. When you are using this can inflate to 300 psi to allow for the rapid infusion. Each of these doors have a clip so the top one's for a liter bag, then like your packed red blood cells, your FFP, and your plasma to make sure that it fits appropriately in the chamber. So we'll go ahead and hang those. Put this on this clip. Alright. Now this is numbered 1, 2. There's number 3 down here and 4. So that way if you've never set this up before, it makes it a little bit easier for you to follow. You're going to start here, press this in firmly. You're going to make sure that this is also firmly seated down. If this is not firmly seated down, it will alarm at you. You're going to come down here. Make sure your tubing is out of the way. This is also the last line of defense to make sure that you're not getting air in the patient's line. Clamp that into there. All right. So for us, this has already been primed. If it hadn't been primed, you would want to prime this before connecting it to the patient. This is already primed, so we can go ahead and connect it to our patient. So for these purposes, we're going to put it into the trash can. So I'm just going to set that there for a second. You're going to turn it on. You want to wait for this to get to 41 degrees Celsius before you start infusing. That way you can make sure you maintain that normothermic fluid that we talked about earlier. So now we're at 41, we're good to go. We're going to turn on our pressurized system. As you can tell, this is starting to blow up. And we're almost, once it gets to 300, we can start infusing. A lot of times too, if it starts alarming at you, it's usually because there's a roller clamp clipped or one of these clamps, so make sure that you change that as well. So now we're at 300, we can start infusing. We're going to undo this clamp, and as you can see, it starts to go. If we were done with this valve and we wanted to switch here, we would just clamp this back off, unpressurize this, then you would do the same thing, pressurize. For training purposes, this will be because we're not hooked to a patient, because the temperature regulator has a little bit more of a difficult time when we're not hooked to a patient. So we'll go ahead and turn it off. And again, this is the level 1 rapid infuser. This is used in trauma patients to provide adequate fluid resuscitation and warm the fluids to promote better patient outcomes.